module up and running. So my name is Chantel Riddle-Uricki, and I'm going to be doing the session today for hand hygiene. Please ensure your cameras are off and microphones are muted. The session is currently being recorded, just so you know. So a little reminder, and for people who haven't been to a session before, there will be pauses throughout the session to give the opportunity to ask questions. Use the raise hand feature to ask a question. Don't forget to put your hand down after the question is being answered. And we'll also have time at the end if you want to just wait till the end. These sessions are designed to help you complete the module, and it won't provide all the answers. It's designed to help you figure out where to find information and or who to ask, so you will have references for the future situations. I'm not going to have all the answers. Some of the answers you're going to have to ask around your own site for, and you'll find that that's what's happening today. Okay. All right. So I hope everyone had a good few days off, and here are our objectives. At the completion of this module, you'll be able to demonstrate the basic knowledge of hand hygiene by completing the following exercises in the module. You'll be able to describe physiology pertaining to skin and hands. You'll be able to identify the indications, methods, and techniques for performing hand hygiene. Describe the hand hygiene program within the infection prevention and control program of your facility using the following key components. What's the purpose and objectives? The use of performance indicators like audit tools, staff education and motivational programs, policy, strong commitment by all stakeholders, and communicating performance indicator results. So first, if you've either got your module up on your computer screen or you've printed it off, we're starting on page 4. So the physiology of normal skin. Well, skin, I'm not going to give you all the answers, but it is part of the immune system. It's the first line of defense, and it has both transient and resident microorganisms, sometimes referred to as normal flora. Describe how healthcare-associated pathogens are transmitted from one patient to another. Well, we as healthcare workers are really good vectors, so to speak. We can pass around germs very well. We can do something with one of our residents, maybe turn them in bed, maybe help with their feeding, give out their medication, not clean our hands, and bring those germs we picked up at that bedside, walk over to the next resident and pass those germs onto them, those microorganisms onto them. And those two residents haven't even been in contact. The thing that brought them together was the healthcare worker. And we healthcare workers touch thousands, probably tens of thousands, people, persons, and things every day at work. So we are very effective at transmitting microorganisms from one patient to another. Why is adherence to hand hygiene the single most important practice for preventing the transmission of pathogens in healthcare? Well, hand hygiene, if you think last week when we talked about the chain of transmission and we looked to break it, hand hygiene is one of the easiest and most effective things we can do to break that chain of transmission. As soon as we've cleaned our hands effectively, correctly, we have broken the chain of infection because we are no longer carrying germs from one person to another person or from one object to another object. What's the correlation between hand hygiene and healthcare-associated infections? Well, we have seen that that hand hygiene, if hand hygiene rates are high, the incidence of disease has been shown to decrease. We have seen this in multiple studies with MRSA transmission, so methicillin-resistant Staphylococcus aureus. If hand hygiene rates in a facility or a community area or a long-term care facility is above 80%, it can drastically cut the rate of MRSA in that facility. Next, if you want to turn to page 5 and page 6, You want to define hand hygiene. Well, the definition of hand hygiene is cleaning your hands using either alcohol-based hand rub or liquid soap and running water. And it also includes, it's a catch-all phrase that also includes making sure your hands stay healthy as well as your nails stay healthy. So the skin and nails of your hands stay healthy. Because when skin starts to break down, a few things happen. People don't want to perform hand hygiene as often because their hands hurt. And then there's a chance for those microorganisms either to get introduced to the person with the skin that's broken down or to transmit microorganisms from that broken down skin to a resident. Outline the factors to determine which method to use. Well, it depends on a few factors. If your hands are not visibly soiled, so if you can't see any soiling on your hands, alcohol-based hand rub is the best bet. If you have an area where you can't install a sink or there's no sink to use, putting up a bottle of alcohol-based hand rub is much easier and very effective. When to wash your hands. Washing your hands with liquid soap and running water is when you have soiled hands. And then also if there's a spore-forming disease like C. diff, you need to clean your hands with running water and liquid soap. However, now what we're saying is if you're taking care of someone with C. diff and you can't get, and there's not a sink in the room, you can use alcohol-based hand rub to do all your hand hygiene. But as soon as you leave the room, go directly to a sink to wash your hands with liquid soap and running water. So which is the preferred method for hand hygiene in a healthcare setting? It's alcohol-based hand rub. ABHR between 6 is what we is sort of like a shortening of alcohol-based hand rub. Between 60 and 90% is our preferred method because it's cheap. It's easy to install where you don't have a sink, even where you have around areas where you do have a sink at the bed-based hand rub. It's easy to use. It's quick and it's easy on the skin. So if you think about it, if you're using alcohol-based hand rub, you put 1 or 2 pumps into your hand, you start to rub your hands together for about 15 seconds until your hands are completely dry, and your hands, you're ready, they're clean and you're ready to do your next task. With soap and water, if you think about it, you have to go and find a sink, you have to run the water to wet your hands, you have to apply soap, rub your soap on your hands for that 15 to 20 seconds, rinse your hands, and then turn off the sink, and then return to wherever you're doing. I'm sorry.
Yes.
Sorry, someone's microphone is on. Please ensure your microphones are off.
Charmaine is doing staffing today, but yeah, because Lisa.
Okay. Thank you very much. So it's quick. So compared to doing it with a sink where you, like I say, you have to find the sink, you have to run the water, you have to apply the soap, rub the soap on for 15 seconds, rinse your hands, dry your hands, and then go back to wherever you were doing your procedure. That's probably 2, 3, 4 times the time you needed for cleaning your hands with alcohol-based hand rub. So a lot of studies have gone through to choose alcohol-based hand rub as their preferred method. So that's just one of them. And really, alcohol-based hand rub has added emollients in your hand in them, so it is actually easier on your hands. People hear the word alcohol and right away think, oh, drying, but that's not quite the case because there are those added emollients. It really is better for your hands for the majority of people than washing with soap and water. Then on page 6, indications for the 4 moments of hand hygiene. Let's just recap them really quick. Before coming into contact with a resident or resident environment. This one says patient, but you can substitute resident in there. Clean your hands at moment number 2 before an aseptic or clean procedure. Last week we talked about aseptic and clean procedures. Then moment number 3 is after a body fluid exposure risk. Please note that after any of these activities, gloves must be removed and hand hygiene performed prior to moving on to the next activity. So gloves do not take the place of hand hygiene. You have to change your gloves as often as if you're doing different activities with the same patient and you need to change your gloves. You have to clean your hands after you remove your gloves before you put on a clean pair of gloves. And then moment number 4, after contact with a patient or patient care environment. You find this in the 4 moments info sheet at wrha.mb.ca. And under each of these 4 moments, it gives you a bunch of examples of what is a moment 1. What are you doing? Like entering the room, helping a person adjust themselves in bed. It tells you what examples, what are moment number 2 examples, moment number 3 examples, and moment number 4 examples. So hand hygiene technique on page 6 also covers adequate time, areas often missed, nail length, artificial nails, ring, jewelry, bracelets, and clothing. So for adequate time, the alcohol-based hand rub or the soap and water must be in contact and be rubbed all over the hands for a minimum of 15 seconds. Sometimes people say 15 to 20 seconds, but it's minimally 15 seconds, making sure you get all the areas of your hands. So if you haven't already, if you can, take the LMS that talks about hand hygiene so you can see how to do proper hand hygiene. Areas often missed. Well, usually the areas people get are the palms and sometimes the back of hands, but areas often missed are the tips of fingers, the nails, the thumbs, the sides of the hands, the wrists. Talking about nail length, nails should be short. If you look at your nails, they shouldn't peek out. If you look at your hand with the palm towards you, and actually I'm just going to turn on my camera to show you guys this. Sorry. Hello. So if you look at your hand, palm towards you, if you look at your hand, I have long nails because I can see the nails of my hands poking out from beyond the tips of my fingers. So if you look carefully, you can, if I'm trying to, so you don't, it doesn't get, you can see the tips of my fingers poking. So measurement wise, that's about 1/4 of an inch, 0.064 centimeters, I believe that converts to. Artificial nails, mine aren't artificial nails. I just had some time off, so I was able to grow my nails in the healthcare system. They have been shown, they have been implicated in outbreaks. They can't be cleaned correctly. They provide little nooks and crannies. They can't be cleaned very effectively. Rings, jewelry, and bracelets, or as I like to say, rings and sparkly things, are not allowed, even wedding bands. We discourage them strongly in the care area. If you need to wear your wedding ring or you want to have it close to you, wear it on a chain around your neck. These, again, they interfere with good hand hygiene practices. They hold the microorganisms in there very well. They're difficult to clean. And clothing can also affect hand hygiene technique. We do recommend short sleeves for people. However, with the colder weather, it's not always conducive to healthcare worker comfort. So if you are wearing long sleeves, push them up to about the level of your elbows before you will clean your hands, or as you're going through your day before you clean your hands, so the wrists of your shirt don't get wet and retain that water and that and some microorganisms. So make sure sleeves up just before you scrub up. It's a little saying we have. Next, background, compare techniques on page 7. We talked a little bit about this alcohol-based hand rub versus soap and water. You can fill it out, lists the strengths and limitations of both. Of course, we've said this already. Alcohol-based hand rub can't be used with visibly soiled hands. If your hands are visibly soiled and you're nowhere near a sink, like say you're providing care in the community or on the side of the street or in a rooming house or something and you have soiled hands, you can use, actually, we recommend using a moist towelette to remove that soiling and then follow with cleaning your hands with alcohol-based hand rub. But that's only if you're out in a sink or a sink is in and not around. Where because you're at the side of the road, or you're in some rooming house, something like that. In something where, like a personal care home, there is always a sink around some corner somewhere. So use alcohol. So go there when you have visibly soiled hands. Again, can't be used with spore-producing organisms. Um, Strength, we've talked about that already. It's quick, it's easy, it's cheap, it's way easier to install some hand hygiene, alcohol-based. Oh, one of the other limitations I forgot to mention about alcohol-based hand rub, believe it or not, is the fire regulations. So you can't have too many bottles of alcohol-based hand rub within a what they call a fire corridor. So between two sets of fire doors, you have to only have so much. And that list is available. You can ask your preceptor for that if you're concerned with that. Soap and water, the strength is it's good for visibly soiled hands. It's good for spore forming diseases. However, it does take longer than using alcohol-based hand rub. And it's how it works differently. Alcohol-based hand rub actually kills the microorganisms versus soap and water, where it actually emulsifies the microorganisms and it gets rinsed away by the running water. We don't like, as far as soap and water, we don't like people to use resident sinks. However, if you need a sink and the resident bathroom is the only sink available, make sure you avoid contamination of hands with potentially contaminated surfaces and objects. So be very diligent, be very aware that you are in someone's bathroom, and think of that flushing toilet, spreading all those germs around. Think of the resident rinsing out their dentures in there, or maybe we've even had people dumping their colostomy bag in sinks. So be very aware that that sink can be contaminated. So wash with soap and water there, but be very careful. Other points to consider, describe safety issues and their solutions. With that information I've given you, you can talk about that. Some other safety issues could be drinking of the alcohol-based hand rub that has happened either because of confusion of the residents in the area or addiction issues. And as well, we talked about fire being a safety issue, so making sure that you're well within the fire safety code, where as to how many bottles you can put up. Describe the impact on the Manitoba Fire Code on ABHR placement. Again, your preceptor will be able to help you find that document. Methods. This is some homework for you guys to do. Review the site hand hygiene policy. So what is going on in your areas as far as hand hygiene is concerned? Are they auditing? Are they making it easy for people to do hand hygiene? Do they have a policy that says they must do hand hygiene according to the 4 moments? So that's a bit of digging around you can do at your site. So you're aware of what some of the limitations are and what things are already in place. Hand hygiene education program. Does your facility or region have a hand hygiene education program? Find that out. If so, when does it happen? To whom and how often? So how often are we recertifying people as far as hand hygiene goes? Is this education mandatory in your personal care home? Who has the responsibility for the delivery of hand hygiene education in your facility? Is it your ICP? Is it your educator? Find out who it is so you know. Page 11, hand hygiene compliance. List factors that reduce compliance with hand hygiene. Well, there could be lack of education, lack of hand hygiene facilities, meaning either sink or your alcohol-based hand rub bottles, poor skin condition of the healthcare workers may lead them to not wanting to do hand hygiene because it irritates their skin. Is there education going on? Is there a culture of safety that people can be asked, have they cleaned their hands lately and not be offended? Will my feedback be openly acknowledged and taken into consideration? Things like that as far as a culture of safety. Culture of safety can also mean, are we promoting hand hygiene as part of our safety compliance? Is there some way to increase compliance with hand hygiene? Well, there's ways, Well, there's ways that you can increase compliance with hand hygiene. Hand hygiene can be increased through use of hand hygiene, I forget the name, with hand hygiene heroes, hand hygiene people who demonstrate how hand hygiene is done correctly. It can be awards, it can be competitions, it can be prizes for hand hygiene, things like that. Reporting to people how they can improve on their hand hygiene. What is the process when a healthcare worker has a complaint of skin breakdown, which could possibly be due to hand hygiene products? Well, it's individually, it's different in every area, so that's a bit of homework for you as well. Go and find out, what do people do? Is there an occupational health and safety board at your personal care home, or is it just one person? Is it someone who has multiple hats, multiple roles, who does occupational health and safety? So if someone complains to you about skin breakdown, you can refer them to the correct person. Is there a strategy to promote healthy skin in your personal care home? Is there lotion around that healthcare workers can have access to? Do they have individual bottles, or is there a shared bottle in, say, the charting area or the nurse's station or the break room, places where they can apply lotion and sort of let it soak on their hands while they do their charting instead of rinsing it off right away if they're running around a busy unit? Monitoring hand hygiene compliance on page 10. Is there a hand hygiene audit process? I know a lot of you are getting trained for the handy audits. For the handy audits. That's great. Who conducts the audits? So find out, is it you? Probably. It will be you. How do auditors learn how to do the hand hygiene audits? Well, there are in-services given by one of our ICPs every month that you can join into. Identify the methods used for collecting data. Well, right now, if you are being trained on the handy audits, it's little touchpads, iPads, personal PDAs where you're collecting the data. Who analyzes data from the audits? Right now, no one is analyzing the audits right now, especially if you're using the old audit system. But with the new audit system, we will be our epidemiologists will be analyzing the data from the audits. How are the audits reported? How do you reach your stakeholders? How do you reach the frontline staff? How do you reach the families? How do you reach the residents with your hand hygiene compliance rates? How is staff provided with feedback from the audits? Do you have meetings that you discuss the results of the audits and how you can do better, or celebrate your victories? Do you have those meetings in place? How are improvement strategies chosen? Do you just randomly choose something, or do you look at your audits and see where you're lacking, where you're not doing so well? Maybe you're not doing so well in moment number 2, cleaning your hands before a clean or aseptic technique. And so you decide to concentrate on that and make people more aware of cleaning their hands before a clean or aseptic technique. And then find out who is responsible for implementing the improvement strategies. Is it your educator? Is it your ICP? Are you part of that group? So those are some homework for you to do. Hand hygiene program on page 11. Do you have leadership support in your personal care home? How is education done? Who is responsible for the education? As before, champions, hand hygiene champions, or their hand hygiene champions or role models. They've been shown to be very effective in increasing the compliance of hand hygiene. Is there resident engagement? So you ask the residents that are able to ask the healthcare workers, have you cleaned your hands before you come into my room? Have you cleaned your hands before you help me turn in bed or give me my medications? So see if you can engage the residents in helping with increasing hand hygiene compliance. Are there environmental controls? Like, what do you have for sinks? What do you have for alcohol-based hand rub? There's ongoing monitoring. So even when you're not auditing, is there time for reminding each other, hey, I saw you went into that room and you didn't clean your hands. You don't forget to clean your hands, things like that. And you can't just audit once. It has to be an ongoing thing where you audit in one quarter, you get the results in the next quarter, you act on those results, and then you audit again in the third quarter to see if how you acted on those results have shown an improvement. And then quality improvement, that's part of the quality improvement process. So documentation and reporting, do you have meetings with stakeholders about hand hygiene rates? Is there a report for the stakeholders? Who receives the final report? Is it just the stakeholders? You should be sharing it with the healthcare workers, the frontline staff, the docs, the nurses, the charge nurses, the aides, everybody. Are items prioritized for action? Do you know what you're going to work on, whether it be moment 1 or moment 2 or moment 3, that you're going to work on improving? Or just a specific time? Yes, we're going to just work on moment 2, but it's specifically we're going to work on when we hand out medication. We're going to work on that time to make sure people are cleaning their hands while they're handing out medication. Is there a date for re-auditing, making sure it's an ongoing process? So you're not just auditing once, you know when to expect the next audits to come around. So that's actually it for today. Do we have any questions? I'm just going to Do we have any questions today? All right, I'm going to take your silence as a no. You don't have any questions. If you do have questions after this, please feel free to email me or to email Davina or to email your preceptor. Um, uh, well, thank you very much for joining me today. Have a great day and Happy New Year. All right, take care.